Treatment time for our shin pain. All right, there's many different options. We can use a tool. Some have heard of Grassin or iStem, where we're kind of scraping through these areas to increase blood flow and break up knots. I find that oftentimes this is tender for a lot of people, right? They're already coming in with some sensitivity around that bone. And so scraping can almost be intolerable. So sometimes what we'll use is these are rock pods, also known as cupping, all right? And we'll place those cups on this muscle, and then that muscle is kind of suction cupped up into the cup. The cool thing with cupping is that once we have these placed, this is us treating that outside muscle that we talked about during our exam, okay? Is that I can then have that patient moving through ranges of motion. And so that's gliding that muscle up and down. Remember when I had that rubber band? So it's pulling that thing down and then relaxing. We can also kind of shimmy these around a little bit, which just disrupts that tissue. All it's doing is bringing new blood to that area, and you can see within just a few seconds we actually have little cut marks. That's all new blood coming towards that area, okay? Very viable option. Next, I'm going to show you our shockwave unit, okay? It is a gold standard for tendonitis, tendinopathies, and it can be used for some of those stress syndromes. So hang out. We're going to switch over. As we just mentioned, we also can use shockwave, okay? Shockwave is acoustic waves going into the tissue that helps bring new cells to the area, so it promotes healing, and it disrupts that area, so it helps flush out some inflammation in the tendon and muscles, okay? Depending on what setting we're using, this treatment actually can go about 5 inches into the tissue, which when we think about that, I mean, 5 inches is really deep. So when we're treating some of those deep hamstring tendinopathies, this is a great option. But for the sake of today, we're talking about shin pain. So we would lay down some ultrasound gel. We spread that around a little bit. Again, this is us treating that outside muscle from our original video. Spread the gel around a little bit, and you will hear the machine turn on. And so we're going to make sure our settings are appropriate. And then you will just hear a clicking noise. That's how we know our treatment is in session. As we work through there, it's sending little pulses into that tissue, and we can go right up against that bone and treat where the overuse injury is, okay? A lot of runners will get a big old trigger point right out here in that muscle belly, and sometimes when we hit that trigger point, it can be a little tender, but after the session, most people report better range of motion, less pain, and then can progress through exercise and rehab better. We would do this for about 2,000 pulses per treatment area. But I'm not going to make us sit there and watch this for 2,000 pulses. So, but those are a lot of our treatment options. It should go without being said, we're also chiropractors, so you better believe we're going to be looking at that ankle joint, the tiny little bones in the feet. We also would even be looking at the hip to make sure that we have good external, internal rotation. So you can see it's a whole kinetic chain. We treat the site of pain with some of our modalities, but then we look at the whole entire system to make sure that our biomechanics are working appropriately. See you guys.